Hello, I'm Ethan Snyder, a physician assistant at the Guam SDA Clinic. Here's a message for your health now. Let's talk about activated charcoal. Activated charcoal has been a part of my medicine cabinet for years. Now it is showing up everywhere, from magazines to DIY websites, for its many uses. It's a kind of medicine that should always be by your side. I never leave home without it. But what is charcoal? Charcoal is a substance formed by burning either wood or coconut shells in the absence of oxygen. What remains after the burning process is a black carbon. But wait, there's more. The black carbon must be activated. The activation process involves heating a pure black carbon to a tremendously high temperature and exposing it to a certain gas through a multi-step process to make it extremely porous. Once activated, the charcoal can bind powerfully to any agent. The porousness of the charcoal allows it to become a powerful binding agent, essentially acting like a sponge and absorbing anything it comes in contact with. This includes toxins, poisons, gases, and germs. Once trapped in the charcoal, these damaging substances become harmless to the body. Charcoal becomes a fluffy black powder that has no odor or taste. It is also available in the form of tablets and capsules. Charcoal is very safe when used correctly. The most common side effect is black stool. At high doses, charcoal can cause nausea, vomiting, and/or diarrhea. Since it is a binding agent, remember, don't take it with other medications as it will bind to them and make them inert. There are many advantages to charcoal that makes it such a remarkable remedy. It is readily available and affordable. It is simple to use internally and externally. Plus, it's highly effective. Charcoal is safe when used correctly, but please remember that charcoal is considered a medication and you should always consult a healthcare professional prior to use. If charcoal is used for at-home remedies, remember to read the label and dosing instructions. When using your at-home charcoal, remember to look specifically at the dosing per serving, as it can vary, sometimes drastically. The more you use, the more likely you are to have side effects. In general, activated charcoal is safe, but remember, you can have nausea, vomiting, or diarrhea. You can safely take charcoal by mouth every 4 to 6 hours, and each dose should be about 500 to 520 milligrams. The maximum charcoal you should ingest per day is 4,000 milligrams. For example, if you have 500 milligram tablets, you could take a maximum of 8 tablets in 24 hours. However, if you start to feel any adverse side effects, stop taking immediately. Topically, or on the skin, charcoal can be applied liberally. With that being said, I would use a small amount on a small area of skin before applying a large amount, just in case. If you have any reaction, immediately clean the area and do not apply any more on your skin. What can you use activated charcoal for at home? Well, you can use it for upset stomach, nausea, vomiting, and diarrhea. I personally take charcoal on every trip I take. If I stop by a roadside stand for some delicious food and hours later my stomach is at war, I take the charcoal to calm things down. Instead of having to spend a few days in the hotel not feeling well, charcoal can save my vacation within hours. The dosing is easy to remember. Just take your 520 milligram tablet or capsule by mouth after meals or at the first sign of discomfort. Some instructions may suggest using after every episode of diarrhea or vomiting. While this may work, please remember to keep in mind the maximum dose per day. If you have any questions, please consult your healthcare provider. When using powder, you can make a charcoal slurry. Common instructions suggest 1 to 2 large tablespoons of charcoal in a glass of water. Charcoal will mix but can be very gritty, and now the black water may not be visually appealing. The use of a straw can help mitigate both of these problems. Externally, you can use activated charcoal for local infection or inflammation, some eye and ear infections, contact with poisonous plants, bee stings, and other insect bites. Activated charcoal is said to help absorb toxins, and applying it topically can aid in healing. If you have never used charcoal before, it would be wise to apply to a small area before use. If you have irritation, do not use. The charcoal poultice is a moist compress applied to skin and is very useful for treating smaller body areas. If needed for large body areas, you can use charcoal in a tub. Here are the directions for preparing and applying the poultice at home. Mix charcoal with a little bit of water to form a wet paste. Be sure it has the right consistency. Spread the paste on 1/2 of a folded paper towel or loosely woven cloth. Then cover the paste by folding over the other half of the paper towel or cloth. Next, place the charcoal poultice on the affected body part, making sure it is completely covered. Cover the poultice with plastic to keep it from drying out. When available, plastic food wrap works just fine. If the charcoal dries out, it will not be able to absorb anything. Finish off by bandaging or taping the poultice to secure in place. A word of caution: home treatment is not a suitable substitute for medical care. If you think you are having a medical emergency, seek help at an appropriate medical facility. Always remember to consult a healthcare professional before use, and if you have any questions about activated charcoal, always remember to read labels and dosing instructions of the activated charcoal before you use it for at-home treatment. Thanks for watching. May God bring you hope and health now.